Namaskar, this is Dr. Sukant Kisodas. As you all know, I am a consultant in nephrology and kidney transplantation. This year, like every year on 29th of September, we are celebrating World Heart Day. The theme for this year is Use Heart to Know Heart. Why it is important to know about heart diseases or cardiovascular diseases as they are scientifically termed as. Cardiovascular diseases form a predominant cause of death all over this world. Nearly 20 million people all over the world have died from some form of cardiovascular disease or the other. Thankfully, 80% of these kind of diseases can be preventable. That is why it is important to know about heart diseases. And being a nephrologist, I am all the more aware that kidney diseases are so intricately associated with heart diseases, and it is very much important to understand the intricate relationship between cardiovascular diseases and kidney diseases. When kidneys fail, because they do a lot of functions which are directly or indirectly affecting a healthy heart function. For example, kidneys maintain a adequate fluid and electrolyte balance in the body. They remove toxins or uremic toxins. They also maintain the blood pressure. They also help in building hemoglobin and maintaining a patient's bone and and of course creating vitamin D and synthesizing vitamin D. So all these factors are indirectly helpful for a healthy heart function. So whenever there is a failure of kidneys, the hearts also fail, and that is why the most important reason why people from chronic kidney disease die is because of some form of cardiovascular disease or the other. It is understood that a person of chronic kidney disease has a twice the rate of cardiovascular mortality as compared to a person who doesn't have chronic kidney disease, but if both of them are of the same age. That is why in my practice, especially because I'm a nephrologist, for understanding, it is important for all the kidney disease patients to understand for a healthy heart, it is very important for them to take care of their kidney ailments. And if they are undergoing dialysis, they have to optimize their dialysis. If they are a pre-diabetic population, they have to take their medications. Their blood pressure and blood sugar levels are to be optimally controlled, hemoglobin level to be corrected, and of course, their dietary habits should be perfect as advised by their physician or their nephrologist. Having said that, let me tell that it is not just for patients of chronic kidney disease, for everyone. Even when those who are apparently healthy, it is important to understand for everyone that to have a healthy heart, because we all have a responsibility towards understanding the various diseases that can affect heart, because as Indians we are more predisposed to cardiovascular diseases. You know that the early age of onset of angina, coronary artery disease, myocardial infarction, sudden cardiac deaths. These are so common in India and especially in South Asian population. So it is all the more important for all of us to understand, not just as physicians, not just as patients, but everyone who is not a patient, not a doctor, or not a healthcare worker, for everyone in general has to understand how important role heart plays in keeping our body healthy, and how by day-to-day life changes a healthy habit we can ensure good and healthy heart conditions. It may be very complicated, but the steps that we have to follow are very simple. Go for regular daily exercise, avoid excessive salt in your diet, avoid tobacco use, avoid alcohol, restrict fat in your diet. If you have a family history of diabetes and blood pressure, or if you have diabetes and blood pressure in early stages, or if you have family history of any cardiovascular disease or heart disease, all these things are to be taken care of by taking regular advice from your physician or from your family doctor. And if required, you should be referred or to a high specialty, so that your heart, your health can be taken care of before it deteriorates further. That is why I want to reiterate the message in this year's World Heart Day. Use heart to know heart. Use your knowledge to understand about your heart disease, and ensure a good healthy life for yourself, for your family, and for the entire world. Thank you.